Hello again, everybody, and welcome to another Inside Lowell podcast. I am your host, Teddy Panos, coming to you from the WellPoint Studios here in beautiful downtown Lowell on a very warm, what promises to be a warm Tuesday morning here in the merry, merry month of May. We're excited to welcome you here to the WellPoint Studios and our special guest to the WellPoint Studios who is doing her best to help fight the skyrocketing costs of health insurance. And we're going to get into that in a quick moment. Just want to thank our sponsors for helping to make this podcast possible. Of course, our friends at WellPoint who bring you the WellPoint Studios. Unicare is now WellPoint. New name, same commitment to Massachusetts and to its members. At WellPoint, your whole health is their whole point. Thank you as well to our friends at Washington Savings Bank. Make the switch now to Washington Savings Bank. TMI Properties, the newest member of the Inside Lowell family, from affordable to luxurious apartments for all. Boston North Company, business solutions for restaurants and retail. And wait till you check out their new POS system if you are in the food service industry, folks. Mahoney Oil, providing warmth and protection since 1925. Francis E. Preventure Insurance, the agency Greater Lowell has counted on for more than 4 decades. And last but certainly not least, our friends at the Massachusetts Pirates, bringing all the action and excitement of Arena Football League to the Mill City. And we thank all of them for helping to make this podcast and all of our podcasts possible. I also want to thank my special guest this morning. She is the president of the newly launched Employer Coalition on Health, and she's got a lengthy history of fighting for people, well, like you and I out there. Eileen McAnneny is joining us here in the WellPoint Studios. Good morning, Eileen. Great to have you here.
Thank you, Teddy. I'm really excited to be here.
So I'm excited because I literally a couple of months ago, I learned about the Employer Coalition on Health, and I started reading into it, and then I started seeing your background, and I said, finally, working class people who are really upset with what's happening with the healthcare system might have a champion on their side. So first of all, tell me a little bit about yourself and your background. How did you come to be a part of this coalition on health?
Sure. So I don't know how much time you have, but I've been involved in healthcare.
All the time we need.
Okay. I've been involved in healthcare policy for probably 2 decades or more. And I've spent my professional career representing employers on Beacon Hill in a variety of capacities. But I started working on healthcare policy when I was at Associated Industries of Massachusetts. And it was during that time that Massachusetts enacted its landmark healthcare law, which was the precursor to Obamacare. Mm-hmm. So very involved in those conversations and what the promise of that was. And then some of the subsequent legislation which was targeted to improving healthcare cost. And that still is, unfulfilled or unfinished business. But I have been doing this more recently. I represented taxpayers as the president of the Massachusetts Taxpayers Foundation, but really looking out for employers, taxpayers, and residents of the Commonwealth's interest.
And who are you partnering with to kind of create this coalition and to fight this battle?
So that's still very much a work in progress. But right now, what I have is about 40 small businesses. I have some health insurers, and we can talk about why that is in a moment, some insurance brokers, but really anyone in the healthcare purchasing space who are familiar with the skyrocketing cost and the impact that it's having.
Okay. So I'm going to just play devil's advocate here, because I do understand, look, you can't talk about controlling healthcare costs unless you've got some kind of a partnership with everybody involved with it. And that's the medical providers, the insurance companies, and obviously the individuals who are getting that insurance. But having insurance companies be a part of this, one might say, isn't that like putting the mouse in charge of the cheese? How do you address that?
Sure. So this is what I would say. I think health insurers in Massachusetts are by and large nonprofit. I mean, we do have some national players that are for profit, but at the end of the day, if employers aren't happy with the healthcare costs, or they're not able to afford healthcare, they go out of business, right? Their sole clients are employers, and to a lesser extent, there are individuals that purchase health insurance, but fewer and fewer of them. And so they're aligning with their customers' interest. And I would say, kind of more candidly, the issue is no one feels sympathy for health insurers, right? Everyone, to your point, thinks they're the big bad guys, right? But all they are is they are negotiating rates, and they're passing them along and providing administrative services. They're not the ones who determine the underlying cost of care, and that's what we're trying to get at.
Okay, so that's an important point. I want to
is.
clarify that because, as you said, everybody hates insurance companies, and every chance a politician gets to place the blame for skyrocketing costs and the complete, in my mind, degradation of the quality of healthcare, it's the insurance companies. They're the profiteers. They're making a profit. You said health insurance companies in Massachusetts are nonprofit.
Well, the largest one.
The largest.
Certainly like Blue Cross or Point 32, which used to be Harvard and Harvard Pilgrim and Tufts. So we have national players, and they are for profit. But I think the dominant presence are nonprofits.
Are some of the smaller ones abandoning the market? I'm seeing this in other forms of insurance that businesses are in, whether liability, property, et cetera. They're just kind of starting to walk away because it's getting too expensive to insure things. Is that an issue? Is Massachusetts suffering from a lack of competitive health insurers?
I haven't seen that so much. I'm not as familiar with that, so I don't want to comment definitively on it, but I think that's really not the main issue here.
Okay. So you mentioned Mass Health 2006, the landmark law that was supposed to save us money, fix our healthcare system, provide healthcare for everybody, and at the same time reduce costs. And then it went national in 2009, 2010 with Obamacare. Again, healthcare coverage for anybody who wants it, and it's going to save us costs. And I even hear the president today telling us they've brought down costs of health insurance and pharmaceuticals and all that stuff. You talk to any person on the street, and they're livid. They can't afford to pay for health care at this point. Where did it go wrong? Why did that promise go unfulfilled?
So there are a few points to make on this, but let me just start with what sometimes it's referred to as Chapter 58, but the Massachusetts Healthcare Reform Law. Massachusetts was in a very different place than the nation as a whole when it came to healthcare. We spent a lot of money on providing free care to people who showed up at hospitals or emergency rooms, didn't have health insurance. And so the notion behind it was, let's repurpose the money that we're spending on what was called uncompensated care and make sure people have preventative care, because that way they'll be healthier, right? They might get the care they need sooner, and it won't, they won't delay it and have it turn into bigger healthcare issues. That was the notion, right? So it was about improving access, and then it was supposed to be about always improving quality and improving the cost, right? That was kind of the three-part promise. And the landmark healthcare reform was all about access, right? So everyone was supposed to have insurance. There was a mandate. You would get help paying for it if you couldn't, right? That was the idea. And we were pretty successful at that. Massachusetts has a really high rate of insurance.
We had a higher starting point than the nation as well. If I remember, it was around the time 80% or 75% of people already had health insurance in some way, shape, or form. And we bumped that up to, what was it, like 95? Or
yeah, I mean, and almost all like people are insured or can access it if they need.
So
right?
Whereas on the national front, I think it was like 60% or something low. So it kind of makes sense that if you have to insure 30-40% of the population, you're going to drive up costs. But in Massachusetts, it shouldn't have been so pricey, right?
Right. And so what I like to say is, in Massachusetts, the law was evolutionary, not revolutionary. Where on the national level, it was a big change. It was a high lift, right? In Massachusetts, not so much. In the vision in Massachusetts, which really didn't happen, was there would be this connector, right? And the idea was you would introduce consumer choice. So I, as an employer, would make a defined contribution to your health insurance. If you wanted all the bells and whistles of an indemnity plan, you could have it. If I wanted a high deductible plan, I could have it. My employer would make the same contribution to both of us, and we would decide what made sense for us. And that was the notion, to unleash consumer choice in all of this. And that didn't really happen.
We also seem to be losing facilities, healthcare providers in terms of hospitals, but also individual practitioners seem to be getting out of the industry. And a lot of them are kind of citing a lot of the conditions, the battles with insurance, the high costs of insurance, liability insurance for them, et cetera. Is that contributing to our problem right now?
Yeah, I think it is, right? Certainly, healthcare has gotten more complicated. There are a lot of what I'll call middlemen involved, right? And so I think it just leads to a lot more paperwork, administrative complexity, and there's certainly room to improve on that for sure. I think the other thing is, hospitals, I think, have realized that if they're fully integrated, and by that I mean you would have doctors, right, that then funnel patients who need care at a hospital into their hospital, and you might have outpatient services, and you might have lab services, and it's they're controlling the whole patient experience, and I think you've seen more of that. And the notion was, if you had these accountable care organizations where I'm responsible for caring for X number of patients, and then I do it efficiently because I control it from start to finish. That was the notion, but that hasn't really happened either, because it's the way we pay for care that continues to be the problem. It's a fee for service, which means the more I provide, the more money I get. And it's not about always what's in the best interest of all involved.
We're chatting with Eileen McAnneny. She is the president of the Employer Coalition on Health, newly formed organization which launched on May 7th. So we're recording this on May 21st. So you're literally 2 weeks old. You mentioned that one of the original goals of Mass Health was to get people who were going into the emergency. They didn't have insurance, so they were going to the emergency room to seek care and to go see a provider, whether it was a primary care provider or whatever else was required at the time. Boy, we failed miserably on that. I spent 11 hours in an emergency room with my father in January. We clearly have not stopped people from going to the emergency room. Is that because of the healthcare system, or is that because of other policy decisions that are flooding Massachusetts with people who simply don't have providers because they've barely been in the country long enough to even have a home, let alone?
So a couple of things that, one, I just want to clarify, when I'm talking about the healthcare reform law, that's different from Mass Health. Mass Health is the state's Medicaid program, right? And that's the federal-state partnership that provides health insurance to low-income women and children, and we've expanded that to now single adults. But that's a different program than the healthcare reform law. I just want to clarify that.
So the money comes from two different pools?
Well, I mean, they're interrelated, but the Mass Health is a specific insurance. It's a public insurance program, right? And the costs are split with the federal government in the state. And I think it is important to point out, in Massachusetts, which is the wealthiest state in the nation, or in the top 3, we have 2 million people on Mass Health, right? That's a pretty high number. And so it just speaks to this unsustainable growth in costs that people can't afford it. But with respect to emergency rooms, I think there are a few things going on. I mean, again, it goes back to the payment system. We don't reward primary care physicians with pay that's equivalent to specialists, right? So if you're an anesthesiologist, you're making really good money. If you're a primary care physician who's seeing 20 patients in a day and then has to do all the paperwork and keep all the records and do all the follow-up, you're making a lot less. And so given the cost of medical school, people are opting to go into specialties. So again, it's all about the way we pay for healthcare has to be changed.
All right. And I want to talk to you before we wrap up today about how we fix it, what you're hoping to do to fix it, if it is fixable, but the quality of care. I want you to kind of address that as well. A lot of folks saying the quality isn't the same either. They're in hospitals and they feel like they're getting pushed out before they're ready as a cost-saving measure. So some folks would argue we haven't achieved either affordability or better quality of care. How much truth is in that?
Well, I think Massachusetts still does pretty well on a relative basis to quality. So even if the quality has deteriorated in Massachusetts, we're doing better than a lot of other states. But I will say this, I think that people are waiting longer. They can't access their doctor. And some of that, again, is because we don't have enough primary care physicians. Some of it is because there aren't enough nurses. So like every other employer in this state, some hospitals are facing workforce shortages, so they just don't have enough people. But some of it is there's no incentive to go and get the care you need at a doctor's office. Some people just show up at the emergency department because it's open 24/7. And so that does speak to, if we want people to get care in appropriate settings, they have to be open longer. A doctor's office can't close at 5 o'clock and half day on Wednesdays. I mean, people need care 24/7.
It's interesting. They're able to provide care for certain groups of folks, and they're literally driving up vans or trucks and providing medical care on site for certain folks here in Massachusetts. Why is it so difficult to provide it to everyone else?
Well, again, I think it has to do with some of the payment systems, right? So in the commercial market, because the cost is going up so much year over year, what's happening is, particularly for small businesses that have to be fully insured, they can't self-insure and kind of manage the cost on their own. So they're relying on folks, for the insurance companies. But in order to afford health insurance at all, they're buying down benefits. So maybe, you as a patient or a consumer, now you have to pay $100 to go to the doctor's office when you used to pay 50, right? And so people aren't getting the care they need because it's cost prohibitive. And then it just manifests later in an emergency, right? So there's probably more use of the emergency departments than there were. And I think some of that stems from shortages, but a lot of it stems from cost.
So how does this get fixed, or at least repaired to a degree where folks will start to see better coverage and more affordable coverage? I know that the House of Representatives here is starting to tackle this. Every time I hear that the politicians are getting involved, I get nervous. I think, oh no, it's only going to get broken even more. What's the first step? What's the first thing that needs to happen?
Employers, purchasers need to make their voice heard. That's what this employer coalition on health is all about. And as someone who's worked in the public policy realm on Beacon Hill for 30 years, what I can say is the employer voice used to be stronger than it is now. And I think the fact that it isn't strong is to our detriment. And what I would give is a perfect example. There's a healthcare bill pending on Beacon Hill as we speak. And it's being done to address some of the Stewart healthcare things. Mm-hmm. But also they're saying it's in the name of cost. But my understanding is it could drive up cost by hundreds of millions of dollars. And so it really is about making the employer perspective on all of this heard loud and clear for the decision makers. And that's what I'm hoping to do. I've spent my career representing employers on Beacon Hill. I understand healthcare policy and really want to act as a conduit between Beacon Hill and the employer community on these issues to make sure that their concerns are being addressed.
And when you say the business people, how can you represent, how do you balance representing the small business people? My family owns a restaurant, 10 employees, maybe 5 or 6 of them are full-time. How do you balance that versus the larger employers who seem to get more of an audience? When they speak up, they at least get more of an audience and maybe do have some influence. Those of us in the small business world feel like, we can sit here and complain all we want. We're like the barking dog that everybody ignores.
Well, so I'd say a couple of things. I think small businesses don't have the resources. If you're a large company, chances are you have a benefit manager who understands healthcare, and maybe you're able to implement policies that help save cost. Maybe you have a wellness program, or you have a gym on site, or whatever it is that helps you to manage your cost. If you're a small business or restaurant like your family, you're busy running your restaurant. You wear 500 hats. You don't have time to engage or to spend a half a day or a day on Beacon Hill making your concerns known. And so that is the notion. You're essentially, if you join the coalition, it's about deputizing me to do that on your behalf.
All right. So we activate our voices and we make them heard and we hope that somebody listens. Now what? What's the big first step? After that, I should say.
So I think there are a few things. I think it's about having transparency in how our healthcare system works, right? Shining a bright light on it. Because as you said, sometimes everyone blames the insurers. Insurers say it's the providers. Lots of data says it's the pharmaceutical companies that are adding cost. So it's about getting data to understand where is the money spent, how do we have to do things differently, what provides value for the premium that we're paying. So a lot of it is just about education and information, but a lot of it is about showing the political will to do things differently. We can't just keep protecting the status quo and think it's going to change.
Okay. The one thing that gives me a little hope that this might be addressed, and this kind of plays into another part of your background that we haven't focused on yet, but the city of Lowell is making its budget presentation now, and there's a line in there about the skyrocketing costs of healthcare and how that's affecting taxpayers, and this covers healthcare for those employed under the GIC. So that's any state or government worker. Their healthcare costs are skyrocketing, so you can only imagine what's happening to ours. Maybe is that going to be the driving force ultimately that gets somebody to try to fix the entire system, or are they just going to work on the GIC component and leave the rest of us to fend for ourselves?
Well, I'm wearing two hats, Teddy, right? So I'm here as the new president of the Employer Coalition on Health, but I also serve on the Group Insurance Commission. And so as you point out, we're seeing average rate increases of 8.5%. And it's important to understand the GIC is the biggest purchaser in New England, or at least it was at one time. So if they're experiencing those kind of rate increases, you can imagine what the small business, I'm sure it's going to be high double digits, which is, taking us full circle. It's unsustainable to see costs like that against an inflationary background where you're already facing cost pressures, right? So something's got to give, and that is the point, to just start focusing on this in a comprehensive and thoughtful way. Because if we don't address this, I worry that the whole system's going to implode. We have to proactively try to fix this.
Yeah. Do you have the ear of the people who are necessary to fix this? And that would be the governor's office, the House, the Speaker of the House, the Senate President, et cetera. I know the Mass Taxpayer Foundation back in the day helped, create some revolutionary change. If I remember, maybe it's evolved, but the Proposition 2.5 was the Mass Taxpayer Foundation, right? That kind of got the ball rolling, and there was some kind of coalition formed, and they were related, I believe. Do you have the clout right now as this with this coalition to affect change?
Well, time will tell, right? But what I will say is this: I have spent my professional career in and around Beacon Hill representing employers. I feel like I built up some credibility, and I feel like people understand that I do know the issues just given that lengthy background. And so I think that, given all of that experience and the connections and so forth, I am hopeful that I'm the right person for the job and will certainly give it my best effort. But what I would say is this: I think it's much harder to ignore a coalition that has hundreds of businesses showing support rather than dozens right now. And so, if people want to make sure that we have the voice of Beacon Hill, it is about joining the effort because there's strength in numbers.
So how do we join the effort? As somebody who's part of two small businesses, how can I add two more to your list?
Okay, well, I'm gonna do an advertisement for the Employer Coalition on Health, and I'm happy to share. Certainly, if you looked up Employer Coalition on Health, we do have a website, but I'm happy to share that email address. Please get in touch. It's my name, which is 𝑬𝒎𝒑𝒊𝒐𝒏 at MassEco, so MassEcoh.org, and really just reach out. Happy to have a conversation. Happy to make a presentation. Happy to answer questions for folks.
All right, we're going to have to bring you back and kind of see how the progress is going, especially since your launch is coinciding with this bill that you mentioned.
I'd love for that to happen.
Good luck. There are millions of people in Massachusetts rooting for you, and probably some eyes in other parts of the country that might want to watch. Right? Massachusetts kind of spawned Obamacare, as you mentioned. Hopefully, we spawn some reform that helps the people.
Fingers crossed that that's what happens.
Eileen McAnneny, president of the Employer Coalition of Health, thank you so much for joining us, and we welcome you back anytime.
Thank you.
All right, and we want to thank you as well for tuning in. Hope you learned a little something from this here on this latest Inside Lowell podcast. As we like to say, Inside Lowell. If Lowell is your home, this is your place. Till next time, stay safe, everybody.